On this Wednesday night, the coronavirus officially reaches pandemic proportions. What it means and what it calls for.
This is a call to action and a call not to give up.
As more countries, including Canada, make plans to act.
We will make sure you have everything you need.
Are Canadian hospitals equipped to cope as the health minister spells out the worst-case scenario?
It's safe to assume that it could be between 30% and 70% of the population.
Social distancing, what you need to know about keeping your distance, slowing the spread, and flattening the curve of infections. And from producer to prisoner, the sentence for convicted rapist Harvey Weinstein.
Global National with Donna Friesen.
Good evening and thanks for joining us. The World Health Organization has now confirmed what many epidemiologists have been saying for weeks. The coronavirus is a pandemic. There are now more than 120,000 known cases in 114 countries. But it's not the word pandemic we should focus on, says the WHO. It's preparation, public health, and political leadership. Because all experts agree this is going to get worse.
The dangers of using a word if people use it as an excuse to give up, or if people see it as something that grows fear. It is not the time for countries to move towards mitigation only, unless and until they are not in a position to affect the course of the epidemic and try and stop this organism. The difficulty is that if you do not try and suppress this virus, it can overwhelm your health system.
In Canada, there are now more than 110 known cases of COVID-19, including a doctor in Ontario who treats cancer patients. And today, for the first time, the health minister gave an estimate of the number of people in this country who could become infected.
I would say that it's safe to assume that it could be between 30% of the population that acquire the COVID-19 and 70% of the population. This seems to be an acceptable range. I realize it's a large range, but that is actually what is our best guess.
Prime Minister Justin Trudeau announced a $1 billion response fund today. It includes money to buy health supplies and to support people who have to stay home from work. More on that in just a moment. In Italy, where cases are still spiking, there are drastic new restrictions tonight. The Prime Minister has ordered all businesses to shut down, except grocery stores and pharmacies. The number of cases is growing quickly in Spain, France, Germany, and the UK tonight. Hungary has declared a state of emergency, and India today put tight border controls in place and canceled all tourist and business visas. Crystal Gamansing on the global response to this pandemic.
My right honourable friend, the Health Secretary, is working around the clock to protect the public's health.
From the UK to Germany to Vatican City, leaders are addressing the rapid spread of the new coronavirus and its impact on health and daily life.
The Bank of England's actions today comprise a timely and powerful package to support UK businesses and households in order to bridge a temporarily difficult period.
The lending rate reduced back to its record low of 1/4 on budget day is a bit of financial comfort.
We saw a large chunk of the budget earmarked for that purpose. £12 billion set aside to help with the economy, with businesses, and of course the fact that so many people, potentially a fifth of the workforce, could at some point be off because of the virus.
The German chancellor also warning of hard times ahead, saying the population has no immunity and no therapy exists. Then 60 to 70% of the population will be infected. It took Connor Reid, a British man who lives in Wuhan, China, about a month to recover from COVID-19.
It felt like I could only use half my lung capacity, and every breath that I took wasn't enough, and I just couldn't get enough air. Also, it sounded like I was breathing through a paper bag.
Italy's health system is overrun. Roughly 900 people are in critical care, according to the World Health Organization's Dr. Mike Ryan.
The fact is, right now, in countries, we have frontline health workers who need our help. We have hospitals who need our support. We have people who need our care, and we need to focus on getting our frontline health workers the equipment, supplies, and training they need to do a good job.
While countries such as Italy and Iran are in the middle of the battle, elsewhere the impact of COVID-19 is just beginning. Crystal Gamansing, Global News, London.
Here's where we're at with confirmed cases in Canada. There are 46 in BC, where a man died at a nursing home. 2 of the new cases there are healthcare workers from that home. There are 41 cases in Ontario, 19 in Alberta, 4 in Quebec, and New Brunswick now has a presumptive case of COVID-19, the first in Atlantic Canada. Of greatest concern is a doctor in Ontario, an oncologist at Hamilton Health Sciences. The woman in her 30s tested positive after traveling from Hawaii on Saturday. She treated 14 cancer patients on Monday, shortly before getting the positive test. She, plus 5 staff who work in the clinic and 3 other doctors, are now in self-isolation. And one of the passengers from the Grand Princess cruise ship has tested positive. The person is among the 228 passengers under quarantine at CFB Trenton. They had passed initial screening in California, but this person had a mild fever and cough when they got to Trenton and are now being kept separate from other passengers. Today, the federal government ramped up its response, announcing a $1 billion package of new measures. David Akin explains what the money will be spent on. David?
Well, half of the new $1 billion fund is earmarked for the provinces, money that can be used to buy healthcare equipment or support mitigation efforts. Another $275 million will be spent on vaccine and other COVID-19 research. The rest is for Indigenous communities and for public health authorities.
We are pulling out all the stops to make sure Canadians stay safe, healthy, and supported.
The federal government is also waiving the 1-week waiting period for employment insurance benefits. And that means anyone who has to stay home from work can qualify for immediate EI assistance. Employers can use enhanced work-sharing programs.
No one should have to worry about their job if they have to be quarantined. No employer should feel like they have to lay off a worker because of the virus. We can support you, and we will.
But critics say more could be done.
What's missing in that plan is any way to help out workers who want to stay home from work because they're not feeling well and don't have access to EI.
We certainly think that there's still a lot of unanswered questions that Canadians will have, not only about this package, but about the entire coronavirus and what it means for Canadians.
Now, Trudeau also said that even though Canada has been relatively lucky so far, federal and provincial health authorities are preparing for the worst, for a sharp spike in Canadian cases. Donna?
And David, we're hearing from multiple public health experts that we need to undertake serious mitigation now, meaning reorganizing our lives to limit who we come in contact with. Did the Prime Minister talk about that?
Boy, he was asked a lot about that today, but right now, the Trudeau government has no intention of restricting freedom of movement or restricting gatherings. Instead, Trudeau expects Canadians to voluntarily make those small changes to their daily lives to keep their families and their communities safe. Ottawa also has no plans to ban travelers coming from COVID-19 hotspots like China or northern Italy. But Trudeau did say this. He said the government will soon have some new rules for cruise ships that dock at Canadian ports. That'll come in the coming days. Donna?
Okay. David Akin in Ottawa, thanks. Washington State has announced strict new controls today. The governor says there could be 64,000 cases in that state if nothing is done. So he has ordered a ban on parades, concerts, festivals, and other gatherings of 250 or more people in the Seattle area where there's been an outbreak. The U.S. has been slow to test in many places. The president has told people not to worry. But today, a top American public health expert made it clear things will get worse. How bad it gets depends on how we respond now.
If we wait till we have many, many more cases, we will be multiple weeks behind. The Wayne Gretzky approach, you skate not to where the puck is, but to where the puck is going to be. If we don't do very serious mitigation now, that what's going to happen is that we're going to be weeks behind and the horse is going to be out of the barn. And that's the reason why we've been saying, even in areas of the country where there are no or few cases, we've got to change our behavior. We have to essentially assume that we are going to get hit. People ask, why would you want to make any mitigation? We don't have any cases. That's when you do it.
If cases in Canada do start to spike like they have elsewhere, Canadian hospitals will struggle. They're already operating over capacity. In some communities, emergency rooms have even closed. So What is being done to prepare? Heather Urix-West is looking into that for us tonight.
In Calgary, new assessment centres for suspected cases of COVID-19 are now in operation. They're a part of the province's pandemic plan aimed at keeping infectious patients away from the ER. Instead, those patients have been asked to call ahead. But across the country, telehealth lines have been struggling to keep up with demand.
We shouldn't conflate or confuse being prepared with being perfect. So we are seeing issues pop up, and as we see those issues, we're addressing them.
Right now, the pressure is on provincial labs and those working to track, assess, and test for the virus. They know that if efforts to contain COVID-19 fail, patient demand on hospitals will soar.
It is important to prepare for a range of different scenarios. But of course, it's sensible to prepare for something worse than prepare for something that's mild.
A worst-case scenario could see hundreds of thousands, even millions of additional patients requiring critical care, far more than existing intensive care units can handle.
In many cases, our hospitals are operating at 120% capacity. They are really concerned as to what the COVID-19 will do to the system.
In Montreal, this shuttered hospital has reopened for just that purpose. Focused now on assessment, the facility treated 20 patients on its first day. But it's not just space that's required. For COVID-19's most critical, ventilators are the difference between life and death. The federal government says it's working to procure additional supplies, but admits that around the world, supplies are becoming tight.
We need to look at where the materials are and how we could have access to these materials and maybe put production in place to increase the amount of supplies and material.
Undeniably now, the road ahead will be tough. With pandemic plans in place, this is no longer a drill. Heather Urix-West, Global News, Calgary.
Well, we know you have lots of questions about this virus. Starting tomorrow, we will answer some of them. Our Jeff Semple has consulted experts and will join us. And you can send your questions to yourquestions@globalnews.ca. On our website, you'll also find a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus. Keeping your distance next, how to act in the midst of a pandemic. It's a big event in figure skating, and it's just been canceled. The World Championships in Montreal won't take place next week. Concern about the spread of the coronavirus put it on the growing list of major events being postponed or canceled. Measures like that, though they seem extreme, are what's required to slow the spread. And slowing the virus is as important as stopping it. Here's why. Carry on as usual, do nothing to limit the spread, and the curve of cases rapidly goes up, stretching healthcare capacity. Put in place measures like testing, self-isolation, and social distancing, and the virus will still spread, but more slowly. So doctors and hospitals aren't so overwhelmed. It's called flattening the curve. It's what specialists in infectious disease say has to happen right now. Mike Drolet explains how everyday life is changing.
We made the decision not to have a studio audience.
A proactive approach to COVID-19 containment in North America. The TV show The View taped before an empty audience Wednesday, an example of what's called social distancing. But that case was voluntary. Washington state has made it illegal for crowds larger than 250 people to gather. It's 1,000 in San Francisco, which will see the Golden State Warriors play in an empty arena Thursday. The idea is people can move about freely. They just can't gather in large numbers.
So if you have a one-on-one interaction with somebody, the chances of transmission is low. But if you have a one-on-one transmission, multiplied 10,000 times, your likelihood of transmission now goes up. And all it takes is a few individuals who have the virus all of a sudden for you to have a few transmission events. And then the virus just kind of explodes from there.
History has shown social distancing to work, provided it's put into effect before the virus has time to spread. In 1918, facing the threat of the Spanish flu, Philadelphia's health commissioner was urged to cancel a large parade. He didn't, and thousands died. At the same time, St. Louis's health commissioner shut his city down, preventing what could have been another tragedy.
We would recommend that there not be large crowds. If that means not having any people in the audience when the NBA plays, so be it. But as a public health official, anything that has large crowds is something that would give a risk to spread.
So what do we do here? Health experts warn it won't take much for the virus to spread as it has in Italy, or worse, Wuhan, China. The band Pearl Jam has postponed its North American tour, but that was a decision they made. The Canadian federal government is leaving those decisions up to the provinces and event organizers. Nobody, it's clear, wants to be the one to cancel sporting events or concerts or close schools. The economic impact will be huge. But what's Plan B? Mike Drolet, Global News, Toronto.
And that is Global National for this Wednesday. I'm Donna Friesen. Tonight's Your Canada is near Cobourg, Ontario. We'd love to see your Canada. Please email it to viewers@globalnational.com. Thanks for watching and hope to see you here again tomorrow. Bye-bye.
This is now officially a pandemic. The World Health Organization confirmed today, although they declared it was not too late for countries to act, saying that they were ringing the alarm bell loud and clear. 196 people have died in Italy in one day alone, while the total deaths in the UK is now 8. The Chancellor has promised the NHS whatever resources it needs to cope, along with other measures to support affected industries and those in financial hardship. More on those budget measures in a moment. But first, here's our health and social care correspondent, Victoria McDonald.
This is what a pandemic looks like. The empty streets of Rome, an entire country in lockdown. This is what a pandemic looks like too. Hospital staff in full protection suits, patients breathing with the help of ventilators. Overnight, the number of people in Italy diagnosed with COVID-19 rose to more than 12,000, with more than 800 deaths. Flying in the face of what seemed increasingly obvious, the World Health Organization resisted declaring a COVID-19 pandemic for nearly 2 months. Today, that changed.
This is the first pandemic caused by a coronavirus. And we have never before seen a pandemic that can be controlled at the same time. WHO has been in full response mode since we were notified of the first cases. And we have called every day for countries to take urgent and aggressive action. We have rung the alarm bell loud and clear.
From the epicenter in Wuhan in China, it has spread and spread and spread again around the globe, this new form of coronavirus. And this is why it is now a pandemic. In the past 2 weeks, the number of cases outside China has increased 13-fold. The number of affected countries has tripled. More than 118,000 people have been infected, and 4,291 lives have been lost. Thousands more, the WHO said, are fighting for their lives in hospitals, and they expect to see those numbers climb even higher.
WHO has been assessing this outbreak around the clock, and we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
A pandemic is declared when an infectious disease spreads easily from person to person in many parts of the world. Without a question, that is what has happened now.
Nothing will change for the UK response, but some countries where they have perhaps not taken the threat seriously enough and do not have in place pandemic plans or testing facilities or the capacity to isolate and treat in intensive care. It means that they need to really consider how they can do this. And in low and middle income countries, that can be quite tricky, and particularly because their healthcare systems are already stretched, and they will need some support and assistance, and international funding will be made available to them.
More than 90% of cases are still in just 4 countries: China, South Korea, Iran and Italy. In South Korea, they now believe they are past their peak and have been applauded for their speedy response. Their advice is to focus efforts on early testing. The WHO said that in Iran the situation is still serious, with a high number of deaths and sick people, and they called for global support for the clinical care of the infected. The UK saw a 22% rise in numbers from yesterday. All trusts in England have been told to identify areas now where they can treat infectious patients. And sources have told Channel 4 News that already some hospitals have cleared wards in preparation. And they are increasing the number of intensive care beds that can be opened. Identify cases, isolating them and contact tracing. That remains at the heart of the fight, but for how much longer? Tonight, the WHO said urgent and aggressive action is required by countries with significant outbreaks.
Victoria McDonald. Well, we're joined now from Geneva by Dr. Margaret Harris from the World Health Organization. Thanks for coming on the program on such a busy day, Dr. Harris. Just tell us very clearly what, by calling it a pandemic, would make or should make the global response to this any different.
Good evening. What this really means, and you're quite right to talk about us calling it, we're characterizing it as a pandemic. What this really means is we've gone from what we were saying for weeks, which is get ready, get your ventilators ready, get your staff ready. Now we're saying take this really seriously. It's here. It's in your communities, but you still have a chance. And this is the unusual thing about this virus. You still have a chance to reverse it if you take the serious, sustained, aggressive action to find every person who could be infected, find all the people who've been in contact with them, work with them, help them understand that it's to their benefit and, more importantly, to the benefit of the people they love, that they do self-isolate, they do quarantine to prevent onward spread. But and that we all, sorry.
No, sorry to interrupt. But what you're also saying quite clearly, and actually alarmingly, is that we haven't got ready enough. And we've had weeks of this now. You know, you've been warning about the effects of this. You've been talking about washing hands and, in some cases, self-isolation. We don't seem to have done enough. And is that why we're in this rather sorry state at the moment?
It's a very human characteristic to think, yeah, but it's not me, that it's somewhere else, it's somebody else, it's somebody else's problem. Now it's everybody's problem. And as I was about to say, the answer is in our hands. It sounds simple, the hand washing. I'm also talking about not touching your mouth, nose and eyes, and thinking about the ways not to take hand to mouth, lots of different ways. And the other really important strategy, social distancing. So how can we limit the close physical contact, which is so much the norm? We've never lived more closely than we do now because we are, even though we're spread out, we're so globalized, we're so close. We spend so much time actually in close physical contact.
But and given that reality, does that not mean that countries where people are still going to schools and universities and restaurants and bars and museums should not be doing any of that?
Well, every country has an outbreak at a different stage. So the time when you can really stop it is when you've got a few cases in your community, and that's the moment when you identify absolutely everybody around them, you stop the transmission then, but you also really mobilize your entire community. You get everyone doing the hand washing, everyone paying attention to really good environmental hygiene, everyone understanding that might be a few cases, but stopping this thing is everybody's business. And where we've seen that happen in places like Singapore, they haven't stopped it completely, but they've slowed it enough so they are not seeing this terrible situation where you've got hundreds of people in hospital and on ventilators overloading the health system.
Given that, what you just said about Singapore, should we here in the United Kingdom be locking down our cities?
Only if you get to a stage where you've got a really big sustained transmission in a particular community. So this is very much case by case. Now, you've got a big advantage. You've got a fantastic public health system. You've got very, very committed people. I've heard about people being mobilized. I've got friends and so on who are on the list, on the roster to come in and help. So you have actually made a lot of preparations. So you have got the advantage, but you still probably do need to persuade your community that this is serious. The time to do something about it is absolutely right now.
Okay, I keep pressing you for guidance because you're there and you know about this stuff. Should we shut down football matches? Should we shut down, the Cheltenham races taking place this week with tens of thousands of people watching horses, jump and gallop.
Certainly, mass gatherings are a problem. They are an opportunity for people to come in close contact, especially if they have to queue or they're in a situation when they have to use public bathrooms and queue up. So when you organise a mass gathering, if you decide to go ahead, you have to do very intense risk assessment and work out how to avoid all the incidents, all the opportunities for people to be jammed together, not able to maintain the hygiene and the social distancing that does need to be maintained to protect everyone.
Okay, Dr. Margaret Harris at the WHO, thank you very much indeed. Let's go straight to Washington, D.C., where we'll find Dr. Jonathan Quick from the Duke Global Health Institute. Dr. Quick, thanks for coming on the program as well. I mean, what the World Health Organization has basically said is that China, with its extraordinarily draconian measures, bought the world some time and that we've kind of squandered it. Do you agree with that?
No, I think two separate things are happening. I think that the China has indeed done a superb job. I think what but in the rest of the world, I think there's been a strong response, but not strong enough. And the problem didn't just start in January. The problem, you don't prepare for a crisis like this in 4 weeks. And globally, we have been under-investing in preparing, and we know it clearly. 6 months ago, the Economist Intelligence Unit, Johns Hopkins and NTI gave us our first map of the preparedness of 195 countries. And 4 out of 5 aren't prepared. And that's not a surprise. So I think we have to recognize that there's been this cycle of panic and neglect.
Okay, we live in a
After the first coronavirus broke out of China in 2003, there was thousands of pages of reports, lots of promises, but we're still now almost 20 years later not as prepared as we should be. Much more prepared than we were, but not as prepared as we should be.
Okay, this may be the wrong analogy, but you've written a lot about the Spanish flu of 1918, which killed more than 50 million people worldwide. Are there any mistakes that we should have learned, after the 1918 Spanish flu that we're committing again this time round?
Well, the key lessons that came out of that is the importance of leadership at all levels. And so I think early on, we didn't have leadership at the local level in China that let some stumbling happen. So that's one, and that needs to be everywhere. Messages from the top that are reassuring. There's some basic principles about be first, get the information out from government sources, be credible, say what you know, say what you don't know yet, be empathetic. Right. So leadership.
Okay, are you getting?
And there are a couple of other lessons.
Right. So, sorry to interrupt. Are you getting that leadership in the United States? Because Donald Trump has been tweeting all sorts of, contradictory things about this virus. Are you getting that leadership in a country that matters to all of us, the U.S.?
Well, certainly we have the strongest public health system and CDC and the leadership in the health community, and I think those messages have been coming down clearly from people who are knowledgeable about epidemics and how to deal with those epidemics.
Okay, and just briefly, one final
we look for.
Go on. Sorry. Do you think that? Do you think in the United States and in the United Kingdom, we should be doing what the Italians are doing now? Because if we're not careful, we're going to be like Italy in 2 weeks' time.
So here's the important thing. When you have no vaccine and you have no proven cure, you rely on public trust, understanding, trust, cooperation. And it has to be based on what's appropriate for the epidemic in that setting. If you call the alarm bell too early in a particular country and too often, when you do, people are going to say, it's them calling the alarm bell. So one of the principles is that each country, and in a big country, each state needs to make that risk assessment based on the realities there, and then move quickly and decisively when it gets to the point where more decisive, more, as the Chinese would say, draconian action, more severe action is needed.
Okay.
It has to be based on the local risk assessment.
Okay. Dr. Jonathan Quick, got to leave it there. Thank you very much indeed for joining us.